This is Hali Lisha, interventional cardiovascular specialist, presenting to you episode 2 of the Peripheral Educational Series. Peripheral stands for Peripheral Interdisciplinary Educational Rounds for Amputation Prevention and Limb Preservation. And this focuses on below the ankle, transcollateral crossing, and the differentiation between midfoot and forefoot transcollateral wire crossing. When a business CLI interventionalist looks at this, and the first thing that comes to mind is the connection between the anterior foot circulation to the posterior foot circulation through the pedal-plantar loop or plantar arch. However, this is different than the usual forefoot transcollateral crossing. This is a midfoot transcollateral crossing, and in the next few slides, we'll be examining the difference between forefoot versus midfoot transcollateral crossing. First, let's go back to the basic anatomy. What you see first here is the anterior tibial artery giving rise to the dorsalis pedis artery and the medial tarsal versus the lateral tarsal branches, which communicate on the dorsum of the foot through the arcuate artery. And the dorsalis pedis communicates with the lateral plantar branch of the posterior tibial artery through the deep plantar artery or the pedal-plantar loop, pedal-plantar arch. This is the most frequent way of crossing from the anterior to the posterior circulation. However, there is a communication between the lateral tarsal branch of the dorsalis pedis artery and often the medial plantar branch of the posterior tibial artery through the midfoot area. This connection can also exist between the lateral tarsal branch and the lateral plantar branch also. This is also a very important pathway to remember for options in crossing difficult circulation. So repeating, midfoot transcollateral crossing goes through the lateral tarsal branch into the medial plantar branch of the posterior tibial artery back into the posterior tibial artery. The forefoot transcollateral crossing goes through the dorsalis pedis artery, deep plantar artery, through the lateral plantar branch of the posterior tibial artery back to the posterior tibial artery. So let's examine the midfoot transcollateral crossing. We're going from lateral to medial, and this is a lateral projection. Very important to visualize the foot in lateral and AP projections to identify the wire course, which is sometimes very tricky. So anterior tibial artery gives rise to the dorsalis pedis artery, which gives rise to the lateral tarsal branch, communicating the anterior to the posterior circulation through the medial plantar branch back to the main plantar branch and back into the posterior tibial artery. This is the AP projection of the previous course, again going from lateral to medial through the dorsalis pedis artery, lateral tarsal branch, medial plantar branch, sometimes lateral plantar branch, back into the main plantar and posterior tibial artery. Of course, this course can be reciprocal from the posterior to the anterior tibial artery. Now let's examine the forefoot transcollateral crossing, which is adopted by most operators. So this is going from the anterior tibial dorsalis pedis artery, deep plantar artery through the pedal-plantar loop or pedal-plantar arch, back to the lateral plantar artery most of the time, main plantar and posterior tibial. And this is the AP projection of the previous wire course. You notice it is lateral to medial through the deep plantar, back to the lateral plantar, and then posterior tibial artery. This is a slide showing side-by-side diagrams of the forefoot transcollateral crossing versus midfoot transcollateral crossing. Notice the course that goes usually a little bit deeper into the foot rather than a little bit shallower on the AP projection. This is through the midfoot. This is through the forefoot. Again, through the deep plantar, lateral plantar for the forefoot, and through the lateral tarsal through medial plantar in the midfoot. In real life, this is a case we've done recently, so let's identify these structures. Of course, let's start from the anterior circulation. This is the anterior tibial dorsalis pedis artery, and this is the lateral tarsal artery, which communicates with the medial plantar artery in the midfoot, back into the main plantar artery, and then posterior tibial artery. This is a turnpike LP crossing this midfoot circulation, and always go on the contralateral, on the orthogonal view to identify the course of the wire and differentiate between forefoot and midfoot. And you can see here that this communication of the microcatheter between the lateral tarsal and the medial plantar is in the midfoot area.